From Denver 7, this is 7 News.
Every year, 600,000 knees are replaced. Most of those cases can be traced back to osteoarthritis.
Yeah, it's a condition that affects more than 15 million people across the country, and mainly people under the age of 65. So we've invited Dr. Derek Johnson from Parker Adventist Hospital this morning. Thanks for coming in.
Thank you for
Talk
having me.
more about your knees. Who is a candidate exactly for a knee replacement?
Well, historically, we thought knee replacement was only for the older patient with significant arthritis. But really what we're seeing today is, with the excellent outcomes we have, anybody with significant arthritis and disability that their quality of life isn't what it once was because of the disability due to their arthritis can be a candidate for knee replacement.
And what exactly does that knee replacement entail?
Well, we don't really replace the entire knee. It's more of a knee resurfacing. We're able to take a little less than a centimeter of bone off of the end of the femur or the thigh bone and a centimeter of bone off the top of the tibia or the leg bone. We're able to realign the limb and then resurface that with a smooth metal surface that allows smoother motion, improved motion, and better function.
So after surgery, what's the rehab like?
Well, it is fairly intense recovery after surgery. Most people stay in the hospital anywhere from 2 to 4 days and then expect about 4 to 6 weeks of physical therapy to regain strength, range of motion, and get back to that function and to the activities that you hope to gain from having your knee replaced.
How have you seen the technology of these knee replacements change over time and, in effect, I imagine, making it slightly better recovery?
Well, yes, historically, the way we performed knee replacement, we had an average that we would try to shoot for. So we used manual instrumentation and really surgeon experience to use guides and tools to make cuts and resections to hope to align the limb and to resurface the knee. And what we found with the manual instrumentations and those averages, we really hit the average about 65 to 75% of the time we'd get what we determined an ideal alignment or ideal implant position.
Very good. So does this end up being stronger or nothing can beat the human body? How does it compare?
Well, it functions very well. What we see in knee replacement today is 95% of knee replacements last potentially up to 15 or more years where they're functioning excellently for the patient, improving their quality of life and function.
Good, good. That's good to hear. That's
yes.
pretty good news.
Yes.
All right.
Dr. Johnson, thanks for coming in and sharing that with us this morning.